Hell.
Hirsutism, unwanted hair. Hey everyone. Welcome back to our channel. Today, we're diving into a topic that affects many women but is often misunderstood, hirsutism. So, let's unravel what it is, what causes it, and how it can impact those who experience it. First off, let's define hirsutism. The term comes from the Latin word hirsutus, which means shaggy or hairy. In simple terms, hirsutism refers to the excessive growth of terminal hair in areas where men typically grow hair, such as the face, chest, and back. This isn't just about having a few extra hairs, it's about a noticeable increase in hair that can be socially unacceptable and distressing for those affected. Now, it's essential to understand that hirsutism isn't about the number of hair follicles a person has. Instead, it's about a change in the type of hair. In hirsutism, fine, light vellus hair transforms into thicker, darker terminal hair due to hormonal influences, particularly androgens. So, what causes hirsutism? There are several factors at play here. The primary culprits are hormones, specifically androgens, which are male hormones present in both men and women, albeit in different levels. 1. Ovarian causes. The most common cause of hirsutism is polycystic ovary syndrome, or PCOS, which affects about 90% of women with hirsutism. In PCOS, there's an imbalance in hormones that leads to increased androgen production. Other ovarian issues, like virilizing tumors or ovarian dysgenesis, can also lead to excess hair growth. 2. Adrenal causes. The adrenal glands, which sit on top of your kidneys, can also produce androgens. Conditions like congenital adrenal hyperplasia, adrenal tumors, or Cushing's syndrome can lead to elevated androgen levels and, consequently, hirsutism. 3. Peripheral causes. Sometimes, the cause is idiopathic, meaning the exact reason is unknown. Women may have regular ovulation and normal androgen levels but still experience hirsutism. Insulin resistance, often seen in conditions like Heron syndrome, can also play a role, as it can increase androgen levels. 4. Medications and drugs. Certain medications can contribute to hirsutism as well. For example, anabolic steroids, some antipsychotic medications, and hormonal treatments can lead to increased hair growth. In summary, hirsutism can arise from a variety of hormonal imbalances and conditions, and understanding these causes is crucial for effective treatment and management. Next, we will be focusing on how healthcare professionals evaluate and investigate this condition. So, what exactly is hirsutism? In simple terms, it's the excessive growth of terminal hair in areas where men typically grow hair, like the face, chest, and back. It can be socially distressing for many women, leading to anxiety and affecting self-esteem. Now, let's talk about clinical evaluation. This is the first step in diagnosing hirsutism. The primary objectives here are to confirm the diagnosis, determine the severity of the condition, and exclude any life-threatening diseases. During the evaluation, healthcare providers will ask about your medical history. They'll want to know about any signs of virilization. This includes things like voice deepening or increased muscle mass. They'll also inquire about the onset and duration of your symptoms. For instance, if hair growth has rapidly progressed, it might indicate an androgen-secreting tumor. Your menstrual history is crucial too. Conditions like polycystic ovary syndrome, or PCOS, can lead to hirsutism. So, they'll want to know about your menstrual cycles and any irregularities. Family history is another important aspect. Hair patterns can be hereditary, so understanding your family's background can provide valuable insights. Next up is the physical examination. Doctors will look for signs of other conditions, such as thyroid disease or Cushing's syndrome. They'll also check for signs of insulin resistance, like acanthosis nigricans, which is a darkening of the skin in certain areas. To assess the degree of hirsutism, healthcare providers often use scoring systems like the Ferryman-Galway score. This method evaluates hair growth in 9 areas of the body, assigning a score based on the amount of hair present. A score greater than 8 typically indicates hirsutism. Now, let's move on to investigations. These tests help confirm the diagnosis and understand the underlying causes of hirsutism. The initial laboratory investigations usually include measuring total testosterone levels. This helps assess ovarian and adrenal activity. The 17-hydroxyprogesterone, or 17-OHP, is another important test, as it's an intermediate in steroidogenesis in the adrenal glands. DHEAS, or dehydroepiandrosterone sulfate, is also checked. It's a good marker for adrenal production. However, if the 17-OHP is normal, testing for DHEAS might not be necessary. In some cases, imaging studies like ultrasound or CT scans may be needed, especially if there's a suspicion of ovarian tumors or adrenal abnormalities. Rapid onset of virilization, unilateral adnexal masses, or high testosterone levels can trigger these investigations. Screening for late-onset adrenal hyperplasia is also important, particularly if there's a strong family history or severe hirsutism from puberty. The ACTH stimulation test can help rule out adrenal hyperplasia. In summary, the clinical evaluation and investigations for hirsutism involve a detailed history, physical examination, and targeted laboratory tests. These steps are crucial in determining the underlying causes and guiding appropriate treatment. We've covered what hirsutism is, its causes, and how it's evaluated. Now, let's talk about treatment options and wrap up with some key takeaways. First off, treatment for hirsutism is not one size fits all. It often requires a combination of approaches tailored to each individual. Let's break it down into 4 main categories: general, specific, local, and surgery. Starting with general treatment. The first step is reassurance. It's essential to explain the condition clearly to the patient, detailing the treatment regimen and the time it might take to see results. Lifestyle changes can also play a crucial role. For instance, stopping smoking and maintaining a healthy weight can help manage symptoms. Keeping your body mass index, or BMI, around 21 kilograms per square meter can reduce the risk of diabetes and cardiovascular disease. Next, we have specific treatments. This includes ovarian suppression methods, which are often the first line of therapy. Oral contraceptive pills, or OCPs, are commonly used. They work by suppressing ovarian steroidogenesis and increasing sex hormone-binding globulin, or SHBG, which decreases free testosterone levels. Notably, OCPs containing less androgenic progestins, like cyproterone acetate or desogestrel, are preferred. Progestins can also be used if OCPs are contraindicated. They help inhibit ovarian steroid production and clear androgens from the body. Another option is GnRH analogs, which are particularly useful for those who don't respond to standard treatments. These should be used with caution, typically for short durations. Now, let's talk about adrenal suppression. Glucocorticoids, like dexamethasone, are used for patients with high levels of DHEAS or congenital adrenal hyperplasia. They work by inhibiting ACTH-dependent androgen production. Moving on to antiandrogens, these are crucial in managing hirsutism. Spironolactone is a popular choice, often given in doses of 100 to 200 milligrams per day. It acts on androgen receptors and can lead to significant improvements in hair growth. Local treatments are also available. For instance, eflornithine hydrochloride cream, marketed as Venica, inhibits hair growth and can be used alongside other treatments like laser therapy. Temporary methods like shaving, chemical depilators, and waxing can also be employed for cosmetic purposes. And finally, there's surgery. This is typically reserved for cases where there's an underlying tumor causing hirsutism. Surgical intervention can be effective in these specific scenarios. Now, let's wrap up with a few key points in our conclusion. Hirsutism is a complex condition that requires a comprehensive approach to treatment. It's essential to combine lifestyle changes with medical therapies tailored to the underlying cause. Remember, patience is key. Improvements can take several months to manifest, and ongoing treatment may be necessary for long-term management. Thank you for joining us today. If you found this video helpful, please give it a thumbs up and subscribe for more health-related content. Remember, you're not alone in this journey, and there are effective treatments available. Until next time, take care.
Form a pal.